This is a StatSite hemoglobinometer. It's just another point of care testing machine. This particular one does just hemoglobins. It comes with a cartridge that we're going to use, and they need to stay in the can until you're ready to use them so that they stay dry. On the outside of the can is a code. This particular case it's 950. When you turn the instrument on, it will read the new code here. You need to make sure that the cartridge you're using is the same code as the hemoglobinometer, because they are calibrated at the factory and your calibration will vary just a little, lot to lot. So what you're going to do, if it's not, is open this up, and here's the battery. You can change that if it goes bad, or this is just a little chip that comes in the can. You just slide that in or slide it out, sort of like the SIM card in a phone. We've got it put back together. We're going to turn it on. Okay. You can see the code is 950, and that's the code that's on our canister, so we're good to go. Like most of our point of care testing, this has got idiot instructions. It shows you that it wants you to put the little strip in. So what you're going to do is you're going to label it with your patient name. We can do this either from a finger stick or from a tube of blood. If we're doing it from a finger stick, we're going to identify our patient before we begin. If we're doing it from a tube of blood, we need to use a properly labeled, properly collected EDTA specimen, just like all hematology specimens. You're going to slide this in. When we're using a tube of blood, which we're going to do today because I'm tired of sticking my finger, you want to make sure that you mix this very well. You can use a fine tip transfer pipette. You don't want to use a standard when it gets too much. Or you can use a little capillary tube with the little bulb on it. And all you have to do, it tells you, put drop on slide. And once you have enough on there, it will begin a countdown for 118 seconds. I'm going to throw our capillary tube in the sharps container. And 118 seconds is a really, really long time when you're waiting for the result. It's a very simple instrument. There's not much to it. There is an operator's guide that goes with it, but pretty much it's idiot friendly. And my hemoglobin is 13.2.